Hey guys, Dr. Glenn from Unlock Health. We're talking today about disc injuries. Now, a disc injury can be really severe, and we've heard a lot of stories about how much that it can affect your life and really get in the way of just bending down, picking things up, or even just jumping out of bed in the morning. I want to give you a lot more detail about what's happening when you have a disc injury, how they occur, why it feels the way it does, what can happen to the different parts of your body when that occurs, how to get it fixed so that it's going to actually be allowed to heal over time, and the different methods and treatments that we can do to actually get it correct in the long term. We'll start off with a bit of structural anatomy about what is a disc and what's its purpose, what does it do? Well, if we didn't have discs in our spine, we'd be really rigid, we couldn't move. Our discs allow for that twisting, that bending motion in our bodies. They're like the mini shock absorbers in between the bones in our spine. So in between each of the vertebrae in our spine, we have a little disc. This helps the body and spine move. It's a shock absorber, so when we're bouncing up and down, when we're sitting in the car and the car's bouncing, it actually absorbs all that force. Now, what it does is, especially to support the body, it's got a jelly-like substance in the middle. This is called the nucleus. This is a proteoglycan type fluid, so it's like a sugary fluid, and that actually helps provide that shock absorber, kind of like a marshmallow. And then around the outside, there's about 30 to 40 layers of annular ligament. So this is like a ligament, strong ligaments, the same as in your ankle, but about 30 layers of rings like an onion around the outside. That's a really strong ligament to hold these bones in place. And it helps your body bend and move and do all those strenuous tasks while still being protected and stabilizing your spine. It protects that jelly in the middle and allows it to work just like the shocks in your car. Now, what can happen over time is the discs don't actually have any blood flow into them. They don't actually have arteries or veins like a muscle does. They get all of their nutrients from the bones above and below. So these bones, they produce blood and they have nutrients inside them. The disc and the bone are actually joined together. So the bottom of the bone is actually the start of the disc, and that's how the nutrients can actually, via a chemical gradient, it actually moves the nutrients into the disc when you walk or run, and fluid gets moved around that. And the toxins and any damage in the disc, that actually gets reabsorbed through the bone so that your body can heal and repair over time. So you do have nerves that enter the disc, but they don't go very deep. So they only are in the outer third. So in those rings of ligament, there are nerve endings, but not in the middle. So you can see that we're kind of set up here because in that jelly in the middle, if that's not healthy, we can't actually feel any changes. So we can have discs have a disruption in that jelly substance and not even know that it's occurring. So it is really important that we keep our spines moving. Our bodies are designed to move to keep the nutrients within that disc so that it can work and be a shock absorber for our body. This will help you move well and prevent any tears or disc bulges down the track. Now, these leads us to how we can actually experience pain from the disc. So when you get pain's created by the receptors at the end of a nerve. So if there's a tear in the tissue or compression on a nerve, this can create that pain. And when a disc can bulge or put pressure on a nerve, that actually creates a lot of pain. A disc, if anyone's had a disc injury before, they know how debilitating it can be. You can't get out of bed in the morning because it's so sore, and that's because overnight the discs will actually hydrate with fluid. It takes about 6 hours of recumbent or lying down posture for those discs to rehydrate and for that nutrients to get transferred through that. As gravity comes off when you're lying down flat as you sleep, the fluid gets restored inside that disc, and that helps it to heal and repair. Now, As you hop up first thing in the morning, that's when we say that we can grow 2 or 3 centimeters overnight. And this can happen because your disc can actually take on fluid, and that fluid will make the size of that disc taller. So that's why you should always measure yourself in the morning, because you'll be a little bit extra tall when you do. And what can happen if we have an injury or a bulge in the disc is, as it's taken water on overnight, when you go and put gravity onto it, this will actually put more pressure in the disc, which can put more pressure onto those receptors or the nerve itself, and that creates more pain. So typically we hear people say, my back feels much worse in the morning, and then as the day goes on, it gets a little bit better. And that's because the disc is more hydrated in the morning, and as the day goes on, it's less hydrated. And you might wonder what things will happen if you skip a night's sleep, or if you're a shift worker and you're only getting about 4 hours of sleep a night. That means that disc, that fluid, cannot repair or revitalize that nutrients into it. So we must make sure that we're getting an adequate amount of sleep in a lying down position to give those discs an opportunity to heal, and also making sure that we're walking and moving with our spine, because when we're standing still for too long, this puts a lot of strain and stress on that disc, and it can actually wear down from the inside out. Now, disc injuries, when they first begin, they always start from the inside. As that inside, that fluidy substance, that jello in the middle, that can actually begin to deteriorate. And we can see that happen as early as teenage years. And teenagers might not even know that it's occurring, because, as I said, the nerves don't go that deep. So the first thing that we see is what we call an internal disc disruption. So that's when the insides of that disc aren't working how they should. This means that the disc isn't working like a good shock absorber anymore, and it's usually created from prolonged postures when you're not moving, especially ones of slouching and forward bending. I know when you sit down for long rides, this can actually make those muscles strain, but it's putting a lot of stress onto those discs. And this does play a role. And also what we put into our bodies, because our body has to have a really good chemical gradient and all the nutrients required for those discs, so that it can get the fluid from the bones into the disc. And now, if we're not drinking enough water, or if we're having any toxins in our body, it prevents that disc from actually repairing and re-energizing for the next day. So when we take that, all of what we know about the anatomy of the disc, and we can put it into how these different injuries occur. So there's a few different types of injuries that you can get with a disc, and the first and most common, what everyone refers to, is a disc bulge. Now, disc bulges occur after what we call a disc disruption. So after that nucleus isn't as healthy, it's not working like a shock absorber anymore, this can actually begin to put more stress on those outer layers. The layers that are like an onion, that strong ligament. When the disc isn't working like a shock absorber, this puts a lot more stress on those ligaments. Those ligaments actually can begin to tear, and depending on the direction of the tear will actually affect what it feels like. Because if the tear is from the inside to the outside, this can occur when someone doesn't even realize they've got an injury. They wake up the next morning and then all of a sudden they've got terrible back pain. And that is what we call a radial tear. The other type of tear is the one that you hear about when someone bends down to pick up a pen and bang, their back goes. This occurs when we call a concurrent tear. So now that we know all about the anatomy of a disc, we can start to move on to how damage or injuries might occur within it. First place to start is what we call an internal disc disruption. This is when the fluid or that jelly inside the middle of the disc can actually start damage to occur. And it occurs when there's not enough nutrients and movement that occurs within the disc, because that nutrients gets drawn from the bones, and movement helps it heal and stay healthy over time. We also need chemical health and nutrients within our body, so our diet and our fluids, to make sure that these discs can stay healthy. And adequate rest, as we said. People need to lay down for at least 6 hours each night to make sure that these discs can counteract all the force from gravity all day. So an internal disc disruption occurs when we're not getting those adequate nutrients to the disc. And this can actually begin to lessen the shock absorbing force that disc can actually apply. So this means that it's like having buggered suspension in your car, because those shocks aren't actually bouncing and springing, and that passes a lot more force onto the ligaments that hold those two bones together. And this leads to our next type of injury. So this is commonly referred to as a disc bulge, but it's a tear or rip in that annular section, which is like the layers of the onion, that the rings of ligament around the disc. Now this can occur in a few different ways. We can get the tearing to occur from the jelly into the ligament. That's what they call a radial tear, or it can occur along the line of the ligament, where two of the layers can actually pop apart. This injury more commonly occurs when someone does a really heavy lifting injury, when they're bending forward, twisting to pick up something, and they hear a pop or even feel a real a snap in their back. Now, when this occurs, this is actually going to send a lot of information along those nerves and create a lot of pain. We find that people really struggle, especially first thing in the morning, and it creates a lot of guarding. When you have pressure on a nerve, your body's defense mechanism is to turn all the muscles on so that nothing else moves, because if it was to move, it'll put even more pressure on the nerve. But sometimes that can be counterproductive, because those discs need movement for them to heal. And those two injuries, they can actually occur because of that internal disc disruption, because the disc health isn't as good. So what might feel like it's happened overnight has actually occurred over a matter of 5 to 10 years prior. Because sometimes we get people bend down to pick up a pen and bang, their back goes. Is that what's actually caused it? Not really. It's the 40 hours a week of sitting down at the computer in that flexed position that's worn or damaged the inside of that disc, which puts more stress onto the ligaments around, and that's when an injury can occur. The next injury we're looking at is more of what they call a disc bulge, and in medicine they call this a protrusion. This is when some of the fluid from that jelly can actually seep out of one of the layers of tearing. This can actually cause a protrusion of the disc. So this is when the disc can actually start to push out of those ligaments. When that occurs, that can actually put irritation on the nerve and actually create a lot of different pain. This can put the sciatic pain all the way down the leg. Depending on which level will depend on what kind of symptoms people get. But when that disc puts pressure on the nerve, that creates a lot of trouble. The body goes into a defense mechanism where it won't bend or move like it used to, and all the muscles grab on and splint to try and protect it. Now, depending on which level this occurs and depending on which nerve is trapped, we can notice a few different things. You might find weakness in your legs or even your hands if it's a disc in your neck. We can also get pins and needles, burning or electric shock type pain, and it can be really debilitating. This leads towards what can happen if this is really bad. Now, if that disc protrusion actually puts force into the spinal cord, it can actually separate from the disc completely. So we can have some of that jelly in the middle, what they call a sequestration. So some of that fluid actually exits the disc and it's floating around in your spinal cord. Now, this is very severe, and depending on what's happening, it actually can create changes in bowel or bladder where you can lose control, and it can actually be very severe. But the good news is there is things that can be done, and depending on where this disc bulge is or how bad it is, it will heal over time. But even in the term of some of that fluid leaking out of the disc, your body will actually absorb that naturally over time. If it's putting compression on a nerve where that nerve damage is potentially going to actually kill the nerve, that's when surgery might be a case, because they need to remove those portions of the disc to actually get those nerves to work well. But if it's only a protrusion or a disc bulge or even an annular tear, that's when chiropractic care actually works best to get these discs healed over time. The other injury that can occur, and this usually happens if a disc injury has been occurring for a long time and when the disc isn't healthy, and that's what they call a leaky disc. This is a broad distribution disc bulge, and that can actually occur when a longer part of the disc is actually bulging out from those bones. So this is almost when the ligaments aren't actually strong and tight and they begin to wear down over time. And this creates a big long bulge which can put pressure onto multiple nerves. And we actually need to make sure that we get that disc loaded and strong and healthy again from the inside out, for that to actually repair. These are all the different types of disc injury, and they have a debilitating effect, but it is important to identify exactly which type of disc injury you have, if you have one, and also if it is actually a disc, because often a disc pain can be misdiagnosed for pain from a joint or irritation to a nerve, or even pain of the joints in the pelvis or hips. So it is important to make sure that the disc is what's causing your pain, and if it's something that can be corrected in the long term. Now we're going to move on to treatment. The good part is discs can heal, and over time they do get better. When you have a disc bulge, it's not there forever, and it can heal over time. But there are some key things that you need to do to get your disc injury healed. So first, let's set some realistic expectations, because different areas and different tissues within the body take different time frames to heal. If you get a cut on your tongue, this can heal in a matter of minutes. It's one of the fastest healing places in the body. There's lots of blood flow, your nerves go right there. It's a really quick thing to heal. If you get a graze or a cut on your skin, this can take a few days, maybe a week to heal. When it's a ligament of your ankle or knee, that can take much longer. So when we're talking about these discs, we don't actually have blood vessels that move into the inside of those discs. So you can already see that this isn't going to be a very quickly healing thing. So it is really important that we ensure that adequate fluid and nutrients and nutrition can get into the disc so it can heal as quickly as possible. But in these areas of your spine, discs can basically take anywhere between 3 months and 18 months to completely heal. And especially when we have a tear or a bulge, it can actually take a long time. But there are some specific things you can do to speed this up as quick as possible, because 1.5 years, it sounds like a long time. And depending on which type of injury your disc has will depend on how long it takes to heal. So it is important to work out exactly which type of disc injury you have so that you know how long it's going to take and what to do to help it recover. Now, when we get to the nuts and bolts, there are the specific things we can do to actually get it healing over time. First of all, this is where chiropractic care comes into action, because the best thing to do is actually walk. Walking will actually get movement into the disc and actually exchange that fluid. And if we want to supercharge getting that disc moving so that it can repair and the fluid can get resorbed, to get nutrients in and toxins out, this is where a chiropractic adjustment can help. Now, a chiropractic adjustment is when a chiropractor specifically locates exactly where that disc injury is or any irritation on the nerve, where we can give it a short little push using our hand or an instrument or a table that drops down gently. This will actually restore the motion in the disc. What it does is that it helps the fluid move again, restoring the nutrient circulation between the bone and the disc, and also encouraging that jelly substance back into the middle. The other thing it does is it resets the receptors in the area, because all those receptors about your safe movement and also your posture, it actually restores them so that you're not getting that big splinting or awkward movement, which will stagnate the fluid and prevent it from healing. So it is really important to ensure that that specific disc is moving well. Often you'll get some motion back in your body, but it's not coming from that specific disc. It's only coming from all the other discs in your spine. And that's where being really specific in exactly which area we're adjusting is vital. That's where a comprehensive exam with any clinician, especially a chiropractor, because that's what we love doing best. We focus on the spine and we love being good at it. So the other things we can talk about now are also reducing sitting time, because sitting's a disaster for these discs. It actually puts more force into the disc, it flexes your spine forward, and it stops any movement occurring. If we're sitting down, slumped over, this causes havoc. Your postural muscles fatigue after about 20 minutes to half an hour, and that's when all that stress goes on the disc, creating a tearing or a ripping. We have to imagine it like a scab or a scar on your skin, but you just can't see it occurring. So it is really important that you jump up out of the chair and go for a walk after every 20 minutes when you've got a disc injury. This will help it actually restore motion and nutrients into the disc. And you think about those long drives when you get an achy back, that can be because these discs are actually stagnated and your body's telling you they need fluid. So the next thing that can really help your disc is restoring your postural false. If your posture is all rounded through the shoulders and your head's forward over yourself, this is like holding a sandbag out from your body. When you hold it out, it's really heavy. If you tuck it in nice and close, it's quite easy. And when your head's all the way forward, that puts a lot more stress and load on your lower back. Just like lifting weights at the gym, it's much easier to have it nice and tight than it is to have it over forward. So making sure that we bring your posture more upright and get safe and healthy movement through the rest of your body will take a lot of irritation off those nerves as well. The other thing that can be important is what we call neural flossing or tension. When there's a disc injury, it's putting pressure on a nerve, it's important to make sure that scar tissue doesn't build up around the nerve. And when we're getting irritation down the leg, we need to make sure that we're moving that nerve back and forward so that it can begin to heal. The next thing is talking about all the different chemical changes in our body. Your discs need nutrients and chemicals to heal. So drinking lots of water is key, because discs are hydrophilic, they'll take on water. It's super important that you're getting a good, healthy diet. Now, we need all the building blocks to create new healthy tissue. And you've probably heard the word collagen before. It is vital to have all of the different minerals, nutrients, and vitamins to actually be able to build that healthy collagen fiber. Because what your body does when an injury occurs is it lays down, just like when you get a cut on your skin, a whiter tissue. This whiter tissue, as you know, isn't as elastic. So that fibroelastic tissue, we need to have some stretch in it. This allows the disc to work like a shock absorber. But when it's that whiter tissue that's not as elastic, this means that it's more prone to injury. Because if we think of those scars, when you pull them, they don't move. So what can happen in the first period of that disc healing is you can actually bend or do vacuuming or lift something you shouldn't, and bang, the same injury can occur because that tissue isn't elastic. So it is vital that your body has the ability to heal from that scarring, that type 3 collagen, back into the healthy, organized, layered type 1 collagen. This occurs from a healthy diet. So making sure that all of those gaps in your nutrition is patched. We actually have specific supplements to encourage these discs, the ligaments in your spine, to heal, to make sure that you've got all the building blocks you need to ensure this disc can heal, and so it's not going to get re-injured over time. The last thing is emotional stress. So how the hell can my emotions affect a disc in my back? Well, this is the interesting fact. There's studies that show that when they've done tests on people's healing rates and given them a stress questionnaire, when we're more stressed, our body takes upwards of twice as long for things to heal. And one wonders why. Because If you think when you're stressed, how well does your body sleep? How well do you move? Do you hold tension in your body? All of these things will stop our body from healing. It's really important that we try and manage our stress levels, get adequate rest for our body to heal. And especially with a disc injury, if you're not getting at least 6 hours of solid sleep a night, it's not going to actually allow the nutrients to get out of the disc and get the toxins out and the nutrients in, So it is vital that we make sure that we're staying on top of not only the physical treatment modalities like chiropractic adjustments and also movement, but also the chemical ones of our diet and the emotional ones to make sure our stress levels are low so our body can speed up that healing process. This can also affect how the inflammation goes in your body too, because when our stress levels are low, it also brings down our inflammation so that disc can actually heal much, much quicker. And the last thing we need to do after this disc is actually reabsorbing and the scarring is healing. It's important to start to load it. So we need to begin exercises, some rehabilitation, so that this will stabilize and not reoccur. It is important to do it in phases. We really need to re-coordinate the muscle patterns in your body, because the underlying reason why this might have happened in the first place is because your body's not moving in the way that it was designed, because of the recurrent postures that we have or the habits, always bending the same way. It's important to reorganize and re-coordinate the movement, make sure it's safe and healthy for your body. And from there, that's where we can start to strengthen and stabilize this disc so it's not going to reoccur. And then most importantly, making these exercises integrated into your life so you have fun with it, whether it be playing golf or going for a run. We need to make sure that you're getting a safe and healthy movement that works for your lifestyle. These are really, really important tips to make sure that the treatment of your disc injury goes swimmingly. So I really hope you felt a lot of benefit and learnt a few things about the discs in your spine, the types of injuries that can occur and how to get it corrected so that it actually heals for good this time. That's Dr. Glenn from Unlock Health. If you're looking to get to the bottom of injury with your disc, or you even just want some more information about what's going on in your body and how to best get the results, feel free to check out our website and make an appointment with one of our team today. Thanks for listening.